5-HTP can help you stay asleep. Herbs, there's a lot of herbs. Again, passion flower, ashwagandha, valerian, lemon balm, California poppy. There's a bunch that, again, have this sort of a sedating, quieting effect on the brain and can help facilitate sleep. Exercise as much as you can move your body, given your physical limitations, the better. We know that I think it's good for your physical and your mental well-being, but it improves blood flow, it increases oxygen, improves your flexibility, enhances your mood. So, I mean, when I first had Lyme, I could do hardly anything. And I was a hardcore athlete my entire life up to that. I would just sit on the floor and stretch. That's about all I could muster. And then I started doing, I'd walk around the house. Then I started walking around the neighborhood and eventually started martial arts and got a black belt in karate. So it took a long time to get to that point, but start with what you can. So think about gentle exercise. Think about yoga. Think about walking. Think about swimming. I like swimming because the buoyancy of the water takes a lot of stress off the joints. If you have a lot of joint muscle pain, the water can be very soothing and helpful. And so you can do you can either walk in the pool or you can do some type of swimming. Tai Chi is called meditation in motion, very low impact, gentle. Qigong, all these kind of things can be a way to help, improve movement in your body without putting extra stress. My feeling with exercise, if you do any kind of movement and then you're wiped out for the next 3 days, it was too much. You got to find the thing that you can do that doesn't wipe you out for 3 days, but actually starts helping you feel good. Stress management, again, this is a whole lecture unto itself. We know that stress suppresses your immune system, alters your autonomic nervous system. It's easy to say don't have stress in your life, but I think we're all coming off a very stressful period in the last few years. And so as much as you can learn to master your stress, it's not realistic to say don't have stress. But how do you help your body manage it? Is it meditation? Meditation's cheap and it's easy. It just takes some practice. You can do something like biofeedback or neurofeedback, which usually requires a practitioner, but can help, again, retrain your brain to deal with stress more efficiently. Support groups or counseling can be helpful if you find that's what works best for you. But find that thing that gets you out of that headspace when you're stressed. Is it art? Is it music? Is it watching a funny movie? It's going to vary from person to person, but have that thing that you have a daily basis of doing that's going to help keep your stress levels down. I just want to mention a few other treatment approaches as we kind of close out here. Low dose naltrexone, I'm mostly always for natural approaches. Naltrexone is a drug, it is a medication. However, it's one that's incredibly safe, very well tolerated, and I think relatively inexpensive. And when you look at the research on this medication, full-blown naltrexone was actually developed to help people get off drug and alcohol abuse. At low doses, it has a very different effect. And basically, it binds to opioid receptors in your brain for about 4 to 6 hours, and then it comes off. But then it increases your own endogenous opioid release for about 20 hours. So basically, it's a way of kickstarting your own natural painkillers. And it's basically used off-label for a lot of things. They've done studies in cancer and fibromyalgia and MS, Crohn's disease, autism, and so forth. So they've not studied LDN specifically in Lyme. I actually wrote a book for the LDN Trust on Lyme disease just based on clinical experience. And a lot of us in the Lyme world do use it and find it helps. It's just it has this way of modulating the balance between Th1 and Th2. These are T helper cells. They're the conductors of the immune system. So it can, again, get your immune system back in balance, help with pain for people who've been dealing with pain syndromes. The one side effect that has been reported is that some people, when they start this, they get really weird, vivid, wonky dreams. So if that happens, we'll usually have people take it during the day instead of taking it at bedtime. It's rare that I have someone that just can't tolerate it at all. But again, it's safe, it's effective. And I'll say with LDN, it's 50-50. 50% of the people feel like they get benefit. 50% of the people feel like it doesn't do anything. But for the cost, I feel like it's worth trying, because for those who do benefit, it's a very inexpensive, safe treatment to help with all these things. And if you've tried it for 2 or 3 months, you didn't feel any difference, okay, great, you tried, but it's not terribly expensive. Like our pharmacy here, I think a 2 or 3 month supply is about $45, so it's pretty inexpensive. So starting dose, you can start with 1/4 to 1 milligram at bedtime, increase every 2 weeks. You can go really high as 6 milligrams. Some doctors use higher. I find most women tend to do best around 3 milligrams, men somewhere around 4.5 milligrams. That's just a general rule. Everyone's going to be a little bit different. But again, I think it's worth trying for a lot of folks. PEMF, or pulse electromagnetic frequencies, these are basically devices that generate a signal that resonates with your own cells. It's at the same frequency as your own human cells. And the Germans have done a ton of research on this, but by producing that low electromagnetic frequency, it falls within that biological window. So there's over 1 million receptors on any cell. And when you put the right frequency in, it stimulates that cell to function better. So we're exposed to so many things out there in the world that are damaging, these bad frequencies: Wi-Fi, electrical wiring, cell phones, cordless phones, routers, all that stuff actually work against us and they can damage our cells. So the goal with PMF is to put the frequency in that offsets that balance. So when you look at the research, we find PMF improves circulation, reduces pain and inflammation, helps with recovery after surgery injury, healing of skin wounds, and acceleration of nerve regeneration. Again, over 1,600 studies on PMF. Most of these devices are currently FDA approved in the US. Some are designed for home use, some are professional. If you do get a home device, I recommend doing at least 2 treatments per week. Some can be short, like 8 minutes, some are longer. The biggest difference between all these devices is the output of a machine. I didn't put it here, but Dr. William Pawluk, Pawluk, is one of the leading researchers out there on PMF. And his website, he's got a ton of research, a ton of studies, and he also has a list of some of the devices that are the more effective ones. So if you're interested in that, I would take a look at Dr. Pawluk's website for more information. Detoxification is always a big part of our strategy. We know that anyone with chronic illness, including those with Lyme, often are poor detoxifiers. So how do we get rid of the junk? Infrared sauna, I think, is the most effective way to get rid of junk. It's an investment of getting a device. You can go places that have saunas, but to be honest, I think it's a better investment to get your own, because then you're not on someone's schedule and having to pay someone to go do it, and you'll have this sauna likely for your entire life. So they have portable saunas. I have like one called Relax Sauna because it heats up very quickly. You can get the big box saunas, but the big box saunas usually take a long time to heat up. So you really have to prepare with when you want to do your sauna treatment. But you could get in the sauna 3 to 5 times a week and it can be incredibly effective at getting rid of mycotoxins, heavy metals, pesticides, herbicides, and just another way to help your body. Constitutional hydrotherapy is alternating hot and cold water. Easiest way is jump in the shower when it's on hot, and then before you get out, flip it over to cold for about 20 seconds. And the reflex action is it opens up your blood vessels and again, kind of gets things moving through your body. There's different companies that make drainage remedies. We particularly use Picana in our practice, but these remedies are designed to target the liver, the lungs, the kidneys, the lymphatics, so that you can start getting rid of all these things naturally. As I mentioned, exercise is a great way to detoxify. And for those who are open, colon hydrotherapy, which is sort of a souped up colonic or enema, can be another way to help detoxify, but then you've got to go someplace to have that done. But again, the action of putting in water into the rectum, stimulating the nerves, gets your body, your bladder, your gallbladder, your liver to start dumping all that bile, all that stuff. And that's where a lot of the toxins are held. So again, I've seen some people who've been through a lot of different treatments and they don't tend to respond well. Once we start detoxifying them, then they respond much better. Treating mitochondrial dysfunction, again, a lot of people with Lyme disease tend to have some element of mitochondrial dysfunction. Lyme itself can directly damage the mitochondria. If you've been on antibiotics, particularly long-term antibiotics, many of those antibiotics also damage the mitochondria. So it's very hard to get your energy back when the organism and the treatment's constantly undermining your ability to create energy. So nutrients like CoQ10, acetyl L-carnitine, lipoic acid, B6 magnesium, NADH, this is what I put in my mitochondrial cofactors, just because all these nutrients are very important for supporting the mitochondria. So again, this can be helpful for getting your energy back, getting your brain function and cognitive function back. Neuropathy is a very common problem with Lyme. Again, these are some nutrients that can help with that. Phosphatidylcholine, I love. It's the fat that makes up a lot of your lipid membranes. There are some practices out there that do IV phosphatidylcholine, but you can also just do it orally. You got to take quite a bit of it, 4,000, 6,000 milligrams a day is normal. Glutathione can be very helpful. Vitamin B12 is very nutritive. I mentioned the PEMF, hyperbaric oxygen. Again, you have to go someplace to it, and it's not necessarily the cheapest way, but that can help with stimulating nerve growth and helping with neuropathy. And for people who have it really bad, there is something called IVIG, which is intravenous immunoglobulin. You have to jump through a lot of hoops to get IVIG. This is a blood product. It's pooled antibodies from donors. Again, it's not my first line of therapy at all, but if you've tried a lot of other things and nothing's worked and you're still struggling with neuropathy, it's worth talking to your doctor and seeing if this is an option for you. Low-dose immunotherapy was developed by Dr. Ty Vincent. This is basically a way to help turn off the autoimmune reaction to Lyme, to strep, to staph, to whatever it is that might be triggering that effect. I find a lot of people with chronic Lyme disease, it's probably the autoimmune effect that's causing more of their symptoms than the active infection, because they've been through a lot of treatment to deal with the active infection and they're still having symptoms. So at that point, it's really this autoimmune issue we need to deal with. So again, by giving you basically dead organism, so if you take Lyme, you irradiate it, you kill it, you dilute it out homeopathically, and then you put it under your tongue, it's a way to help sort of, again, turn off that reaction to that particular organism. So again, I have an entire lecture on LDI, which is like a 2-hour lecture. If you want to know more about this, I just recommend go to YouTube. Dr. Vincent has a lot of videos on LDI, low-dose immunotherapy, talks about what it is, how it works. And so if you're interested in that, there now are a lot of practitioners around the country doing LDI. And again, I've found it's a game changer with a lot of my patients. So I'll usually have them on herbs first. Let's get the load of organism down. And then once we do that, then the next step is do LDI. Now let's start modulating that immune reaction to the organism. So in summary, when we're thinking about the global approach to Lyme, we want to treat the organism. We want to help, deal with all these other immune distractors. If someone's got food allergies, environmental allergies, all of that distracts the immune system's ability to naturally fight infections. We want to work on detoxification. We want to fix the hormone problems. Make sure you're getting sleep, get the inflammation under control, optimize nutritional status, improve mitochondrial function, improve circulation, modulate the immune system. This is sort of what I'm thinking of is with each person as we go through Lyme, making sure that we're checking off all the boxes, because if you leave one of these open, it makes it harder to get well.